aesthetic goals seem to be appearing more in the younger age group is because there is some phenomena called baby Botox. Very young teenagers are opting for Botox treatment, which was seen something for, aging women. Do you think Botox taken so early on or fillers taken so early on, is it good or bad? What would you comment?
In my practice, yes, I do got some inquiries where it's very school going kids, they're coming for these baby botox and fillers. I don't encourage personally, but somebody having the deformities by what is called congenital deformity, where there is called facial atrophy and other things, where we suggest some facial fat grafting and fillers for a obvious deformities because of the birth defects, but not for the fashion at a younger age group. Once they cross 21, 22, once they become teenage adult, like where they have the decision to take about themselves, not get just influenced by their friends or not. So for them, yes, if they have a proper deformity, there are plenty of treatments available at Prosonics where we do treat.
Okay, so these are like a thin line. I think in cosmetic and cosmetology and cosmetic surgery, there are too many faint ethical lines where it has to be tiptoed. But I just wanted to understand, sir, that because of influencers, the earning capacity has also become like, at an earlier age, people were started to earn after the age of 25, 26, and now they are like at the age of 18 and 19, they are coming. But some of them really have serious issues, but the parents don't support, or in some cases, spouses don't support. How do you tackle with this issue where the client is ready, but the environment is not there, and they do have body image issues?
Yeah, very good question, Dr. Neha. Actually, this is one of the major problem in our consultations, where the client themselves, they want to get done, but the relatives and the parents, they may not be. Here, what is first thing I'll assess is it really needed or not? And if it is needed, then most of their relatives or the parents or the spouse, they're worried about mainly the safety. More than finances, today's world, people are worried about the safety. So when I'm able to execute it safely, like suppose if recently the people flying to moon, because they're ready to spend so many lakhs of dollars to go to moon just because it is safe. So safely they can return back to earth, their home. They want to experience. So here, what I'm stressing, if it is safe, like if I'm able to execute safely the good product and the procedure is executed safely, then I definitely convince them by telling about the standards of what we take to execute all these things. And second thing, I'll show the examples of previous clients who underwent and how their body image is okay. So these are the things I'll put in front of them to convince them about the safety.
Okay. So, sir, because this is cosmetic surgery, even in pages like where psychology is discussed, even in those web pages also, they don't mention as cosmetic surgery as a treatment option. They'll talk about everything, psychological counseling, medicines, but they don't talk as cosmetic surgery as a treatment option. Do you think cosmetic surgery is really a treatment for these kind of issues, or it is still a choice?
Yeah, rightly said, Neha. Like there is a very thin line here where the people see the normal person who has a negative body image. We can't tell them that they are a psychiatry patient. They are normally working in the field and performing excellently. And just because they want to correct their tummy, we can't categorize them into psychiatry client. So you should analyze their how much deformity is it really concerning point. Yes, we need to address that. So here, what I assess once the client comes to me, when they express, first I'll assess their psychology, how stable that, or is the deformity what they're telling to that they're presenting to me, is it really grossly present or not. If it's some people come like very 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 minute deformity way, they say that in certain angles and in certain zoomed things, in certain kind of light, I'm able to see that. So if I'm not able to appreciate that with so much of my knowledge about human body, then I'll straight away deny that no for that. But there is a big scope for improvement. I have seen so many clients, even a woman who is 55, 60 years age, who came for tummy shaping at that age to make herself better looking without any comorbidities, good exercise and working out and properly diet. Still, because of her 2 3 kids, repeated pregnancy, she has a deformity of tummy, not able to wear their desired clothes and presentability in a multinational company. She got done, healthily recovered, and she's absolutely enjoying their this one. So my point is, cosmetic surgery has a big role in changing their perception about their body. If it is first thing is that selection of the client, it should be proper, client should be selected, and second is properly executed, and proper atmosphere to execute that, and proper techniques, technology to be used. So nowadays with this advanced technology, we can able to execute very safely multiple procedures in the body. And here, choosing the surgeon, choosing the doctor, right doctor, should be very, very important thing. Because of today's demand in society, the cosmetic procedures, people are left and right, like salons, they have opened up multiple centers without any qualification, and they're ruining. To give a simple example, the other day, the people for a split earlobe, they went to some person, and they just glued it and lead to a big dirty scar in the ear, and they came up. So it is because of a wrong choice. And one more point is that because it's cosmetic surgery, there's a social taboo still in Indian society. People want to hide and get it secretly done. So they'll fall prey for it and get into a small center and get this, and then they get complicated and land up with us for further correction. So this should be taken care, and you should choose a proper doctor who is board certified, and need to be checked their pre-post results, and you can obviously judge yourself by meeting to a qualified doctor how confidently they're speaking and how many years of experience and all these things.
Right. So I think thank you so much for all the insights. I think the only conclusion I would take is you can embark onto your cosmetic transformation journey. Just choose the right guide.
Yes.
Thank you so much.
Thank you.
Have a good day. Bye-bye.
Bye.